Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Geography and regional differences can play a major role in health disparities and access to cancer care. Today, we look at one cancer center's approach to address those barriers and improve care for patients with chronic lymphocytic leukemia, or CLL. We'll learn about a collaboration with local community organizations to support underserved populations. Joining us today is Dr. Farrukh Awan, the director of the Lymphoid Malignancies program at the Harold C. Simmons Comprehensive Cancer Center at the University of Texas Southwestern Medical Center in Dallas. Dr. Awan, what are some of the common barriers to care experienced by your patients?
There are multiple barriers for patients to get care at major academic centers. The first one, obviously, is the distance to the care centers within the city, outside the city, time to get to appointments, the driving distance, the traffic issues, the cost of travel, housing, lodging, food. I think those are some of the biggest challenges that we see in our patient, especially in our part of the country where distances are huge and traffic can be an issue in major cities because of certain locations of the larger academic centers.
How does your team address social determinants of health?
There are multiple ways our team can help with patients, and depending on the social situation, so providing assistance with just the cost of fuel, housing, lodging, that's a major expense. Working with co-pay assistance, FMLA, leaves, job issues, days off, time off, disability, paperwork. There's multiple layers of support that we can provide to our patients based on the specific situations. There is a team of uh, social workers, case managers that are involved on a regular basis, working with the financial counselors to on the patient side and on the hospital side. And I think that goes across the entire country essentially. And those are the same challenges that multiple patients would face all over the country. So providing them with a systematic system in which your navigators work closely with these team members, we feel is critical to addressing all of their issues, including monetary issues, social issues, financial issues, job issues, and so on.
Why is it important to test before treating?
So the patients that are referred to our practice are typically patients who would seek a second opinion or patients who have a complicated situation or some issue going on. So our general practice is to perform the entire CLL prognostic panel so we can accurately identify what the risk scores are and risk factors are, and we can inform treatment decisions much better. Without that knowledge, a lot of times it's guesswork. Now, fortunately, what's also happened is as our therapy has evolved, things have become more simple. But then therapy selection is more complicated now than what it used to be. So it's a combination of a discussion with the patient, but having all the information up front allows us to make the best decision for the patient in that situation.
What would you like to see accomplished in CLL care?
The ultimate goal, obviously, is to provide a curative therapy for all our patients without having to deal with a lot of toxicity issues. So I think that's really is the ultimate goal. We're not quite there yet, but in the meantime, there are two main approaches of therapy for CLL right now, and that's the ongoing debate in the field. And one of that approach is that you continue on treatment perpetually and you try to suppress the disease and people can live a normal life. So that's one approach. This is kind of analogous to diabetes management or hypertension management in this country. The other approach is that you treat the disease when you need to, and then you take a break, and then you treat again down the road. So I think that those are the two main approaches for CLL, and based on the patient situation, the comorbid conditions, the access to care, and we talked about the social determinants of health. That's a decision that is made on an individual patient level after a discussion between the patient and the provider and their preferences.
We appreciate you joining the show, Dr. Awan. ACCC has put together an education program focused on regional challenges to providing equitable care for patients with CLL. You can find a link to that in the show notes. If you liked what you heard today, make sure to follow the Cancer Buzz channel on your favorite podcast app for more tips and fresh discussions on the latest in cancer care. This episode was made possible by support from AstraZeneca, Pharmacyclics, and Janssen Oncology. Until next time, this is Summer Johnson.